Hi, my name is Robin Kahn, and this is my good friend, Dr. James Sawyers. And
Hello,
we have
Robin.
a great program prepared for you today. We're so excited. But first, we have our friend Griz from WCAT.
Right.
He's our mascot. What are we going to do today?
Our mascot is due for his annual shots. I brought along something new that I think Griz will greatly appreciate if we can get it done.
Okay.
They've been working on combining different diseases into one vaccination. It used to be that we gave him one rabies shot in the muscle, we gave him one distemper shot, and then one leukemia shot. And, you know, we could always get it done, but they've developed something where I have now all of those diseases in one shot.
So this would be more convenient for a cat like Griz who's ready to take off in a
Right,
minute.
the vaccine is perhaps a little more expensive than the individual ones, but I think Griz is worth it. Plus, the way he's sitting here growling at me, looking very unhappy, I just as soon just stick him once and be done with it. He's in good physical shape. He gets this, well, he's been putting on a little weight lately, about the diet you've
He
been
looks rather
feeding
healthy.
over here. And I'd ask you kindly to hold our reluctant pace and just give him a little scruff.
Okay.
Because he's not too thrilled, and I mix
And
this
you wouldn't
vaccine up.
believe how strong this cat is. That's what's so amazing.
Well,
amazing to me that you see them holding on, lion tamers holding on to this great big cat.
You've got a small lion right there, I'm sure.
Griz is pretty strong.
It's usually
Hello,
tougher
Grizzy.
when you actually have to hold on to a cat than a dog because there's 5 things to dodge. You got the mouth and you got 4 little paws that are full of sharp claws most
And
times.
Griz isn't declawed either.
He's
So
he's
he's
ready
a
to roll.
little-
He gets
yeah.
out every now and then. I
yes.
wouldn't want to declaw a cat who goes out at all.
No, so
First
you
thing
just
ever.
recommend declawing a cat that stays in, right?
Well, only if they need to be declawed. Actually, if they're one of those beasts who destroy the furniture, then it makes logical sense to perform that service. But if they're pretty good, I leave them alone.
Okay. But we never do their back claws, right? Just the
I have
front
done them on
claws?
occasion, but the fronts are only all that really needs to be done. Those are the ones that do damage to the furniture. I know Griz is kind of shredding one of the chairs up in the office. Okay, Griz.
Okay.
Now,
Oh, wow.
hiss and fuss.
Hissing and spitting.
Well, Griz, you know, it's still a law that you have to get every cat, even indoor cat, a rabies shot. So this has now made him illegal for another year.
Okay.
Now, one thing that they always do is check his teeth, because last year we had to clean his teeth. They're getting kind of nasty.
Remember that.
And then we did even tape, oh, he's got a little tartar building up there. We'll chip a little of that.
Okay. And then they should be maybe brushing his teeth here at the station?
If they could catch him, I'd say, otherwise,
Okay.
good luck. All right, and the other thing we'll do is try to save,
We're going to trim Griz's nails a
we'll
little bit
save
too?
Mark's chair.
Okay.
Just trim the nails, you
Okay,
gently
and I'll
squeeze
scrub
his little paw,
Okay.
and take the nail sheath out.
And
just-
Griz is growling away. I don't know if you can hear it, but he's not too happy.
And we'll just, you trim just enough to get the clear portion. You'll see a little bit of pink. Actually, let me just slide them over a little
Okay.
more. Thank you.
You're welcome.
This is called the reluctant paste. Thanks for the input there, Griz. The clear
Oh, his
portion
nails
of the
are
nail.
long,
Oh yeah,
too.
and they're sharp too. There's a little pink at the base you can see when you express the nail.
Okay. Well, you have one more,
Easy.
Griz.
One more,
Okay.
Griz.
Good boy.
There we
Oh,
go. No,
okay.
wait. Now this is the famous Griz countdown around WCA2. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go, Griz. Zoom.
Oh, wow.
Griz, aren't you happy? You're legal for another year.
So
I
all
don't see-
cats need to have rabies shots every year.
Yes,
and
especially
they
right
should-
now.
Okay.
The rabies outbreak is still very much with us, and it's actually, I think, probably going to be even worse this year than last year as far as number of cases. There's actually been more activity in the rest of the U.S. too. I was reading one of my veterinary journals, and they've actually quarantined one section of Texas this month from coyote and canine-based rabies, not so much the raccoon strain that we're dealing with in Massachusetts, but rabies is still with us, and it's going to be a problem for a little bit longer.
And then that would be dangerous more for animals like that, or that affects all animals, rabbits,
The rabies,
anything
all right,
that's
whether you're talking about the bat strain of rabies or the raccoon strain of rabies is pretty much irrelevant except for where the virus came from and what species spreads it the most. As far as the effect on humans, they're fatal. I mean, any one of those strains can do you in and cause a nasty disease that's fatal.
okay.
So
So
that-
everybody has to be.
Everybody,
No matter
yes,
what.
dog or cat, you've got one that has to get a rabies shot now. No
Okay,
problem.
and then Griz had all of his shots, and you have
He
the
was one of
new
the,
shot.
yeah, he got one of the combo shots there. It used to
Okay.
be, and actually they have several kinds. They have they have another thing for dogs, strangely enough, but it's all the combo shots
I
have
was
been developed for
wondering about
cats.
that.
They have a rabies distemper for cats. They have a distemper leukemia for cats, and then it just came out with, the last couple months ago, rabies, distemper, and leukemia, all in combination for felines
So
only.
this is very good for a cat like Griz who hates to go to the
It's
doctor.
good
'cause
for
you can-
nervous kitties because you
Yes,
only
you
got to
get
catch them
everything
once,
done at
and
once.
that's right. You don't have to use multiple pinholes. And every cat I've asked has requested it if possible.
Oh, okay.
We don't always have it in stock, but they
You know, I
like
think it
it.
would be interesting to our friends out there for you to tell them if someone does have a cat who is absolutely impossible, how do you deal with him in the office? I noticed you
Quickly.
had, yes, very
Quickly,
quickly.
very
I
quickly.
noticed you can either use a blanket or you had something special, and it looked like some kind of a carrying of.
Well, okay, the first thing is when you have a cat who's very, very nervous or difficult to handle and aggressive, you want to bring him into the office in some kind of a container, a box, preferably. They have those plastic cat carriers, or even a cardboard box, although once in a while cats can kind of shred those cardboard boxes. Once you've got them into the office, then we can take over. We have everything from tranquilizing drugs we can give them if they're really crazy to settle them down. We have long leather gloves that you can wear,
Yes.
welder's gloves to protect the assistants from holding. One trick that I like to use, because it doesn't stress them too much, is I'll just take a big old heavy blanket and just throw them right over the top of the cat. And while they're trying to fuss with the blanket, I lean on the whole pile and lift a little corner, find a leg, and pow, the shot's done.
Okay.
Physical exams are rather limited in those cats, of course, for safety's sake. We have once in a while when we have to do some kind of a detail procedure, they even have something that's called a rabies pole, something that you might see the dog officer use to catch a stray
Yes,
dog
I've
with
seen that.
a long metal pole with a padded loop of wire so it won't cut the animal. It's padded enough that it will be able just to hold them and restrain them, and you kind of loop them and cinch down on it and woo, and watch the pole jump around.
Oh, I think that's important because there are a lot of people who would like to bring their animals in, but they're so afraid of the way they act. They can't.
They can't
So
control the
now
animal
there's a
sometimes,
way
but that's
that
where,
they
yeah,
can bring them in.
once someone gets an animal into the office, the vet will
Can
take over.
care of
Yeah, we can
everything.
take care of just about
Okay.
everything.
And I understand we're going to talk about older cats.
Yeah, I brought along one of my cats. I mean,
Okay.
it's sometimes valuable. I live through this stuff too that I preach to people day in and day out. So I brought along my cat I've had for 21 years, at least almost 21. Her name is Peaches, and she is now entering into a phase of her life called kidney failure. Such a threat. Let me go get Peaches and bring her in.
Okay. And so this shows that even older animals, dogs or cats, can still live life fully. Oh, Peaches.
Here's Peaches, yeah. Poor, relax, kitty.
Oh.
She's a little high-strung,
this out
nervous
of her
cat,
way.
but yeah, what do you think, kitty? Relax, yeah. Peaches is a female spayed. She's 21 years old. I've had her since I found her in her car when I was going to vet school out in Indiana on a cold day. Brought her home to find her a home, and I'm still looking, I guess. After 21 years,
girl.
I figure she's been good. And she's always been a very thin and small cat. That's her normal size and body shape, so many of the clues that I get from other patients I didn't have myself. As she got older, we ran blood tests, and I knew her kidneys were elevated slightly, but she just entered into this about a month or two ago. The signs that I noticed that you might see in your own older cat is she got a little quieter. She just wasn't as active. She wasn't running around quite as much. But, at her age, that's kind of expected anyway. See, I was the basic owner, just like anybody else, running around going to work all the time and having to,
And do they have like excessive thirst when they get to that point and just not eating too?
In her case, I really don't know
Peaches.
because
Oh.
the water bowl is down in the basement.
Right.
And so I never saw her drinking that much more. Many people will notice that a cat in kidney failure will drink more. The other sign is they don't eat as much. They're a little more depressed. They're a little more nauseous. So their appetite drops off. She also lost weight, which in her was very noticeable because she's always been so thin. A little bit of weight loss in her showed up very dramatically. And the other thing that I saw in her was that I expected I would pick up, that I wouldn't expect too many other people to pick up, is she became dehydrated. as you test a cat's hydration, it's really relatively simple. You grasp a fold of skin right over the shoulder, pick it up, and then let it go. Now, right now, she's well hydrated. You can see how the skin just snaps right back down. But when it goes down very slowly, just kind of hangs there, that means that the cat is dehydrated. In other words, her fluid balance is not proper.
Is it harder to tell with a cat with excessively long hair? Like if you had a Persian cat,
Yeah,
you know, because they have so much hair, or their skin, would it just hang like a person?
you just have to look at the skin fold. It perhaps is a little more difficult, easy girl, to go ahead and, yeah, poor baby, she's a nervous type. She gets stressed easily. It is harder perhaps to deal with a long-haired cat as far as finding the level of dehydration, but it's still pretty easy. So when I noticed these things after I'd gotten back from my winter vacation, I immediately ran her into my clinic, tested her blood, which is what we do now routinely for so many of the older cats to try to catch these things.
And you do this if you have an older cat before they're ready to go in for surgery,
That's
or
right.
if they need any procedure,
very
even
routine
dental
now.
work,
Whenever
I
you're going to
noticed.
stress an animal with any kind of a procedure, an anesthesia, a potent drug or something, they'll want to run a blood test to check the liver, the kidneys, checking for diabetes, and just kind of screen all the basic organ functions. And with her signs of vague depression, and one of the things she was doing slightly was she was starting to vomit more. As the BUN, which stands for blood urea nitrogen, goes up, the animal feels more nauseous. The BUN is a measure of waste in blood, and as her BUN goes up, the animal feels a little more nauseous in the throat.
And what
more.
were her numbers? I know, I
right,
remember you told me her numbers were incredible.
Yeah, a normal, she's really done very well. It's very nice to save your own cat, I tell you.
know.
Very depressing when you can't even
I
help your
know.
own. Her BUN was 150. Normal is about 25 or 30. And with a little intensive care, luck, fluids, and constant monitoring for a couple of weeks, we got her down to about 41. So she's still not normal, but she's far, far better improved. The treatment course for kidney problems is initially kind of broad spectrum antibiotics in case she has an infection. And I think the most useful thing is fluids. We've got to get fluids through her to flush her out.
Yeah, I know there's 2 kinds of fluids, right?
Oh, we have many kinds available to us. It doesn't seem to be as imperative which fluids you choose. Like when you do a blood test, you'll find out things like, perhaps her electrolytes are messed up, her sodium or potassium maybe high or low, and the phosphorus is often very high. So you want to choose a fluid that's most appropriate for each individual situation. Initially, she had some low calcium, no, excuse me, it was low potassium and low sodium chloride, so I chose to give her a fluid called lactated ringers. But that's almost irrelevant. The treatment you do when you have a cat and kidney failure is flush them out. You have to lower their toxic levels.
And would you recommend also, in addition to that, giving her more fluids at home, as much as she could drink? Would you
You always give them a free choice to water, but the trouble is by the time they start to go into actually acute kidney failure, they're almost too weak to eat or drink by themselves. So you have to kind of nurse them back, and some do well and some don't. I think the oldest cat at my clinic was 24, and we're going to try to get her there. I don't know if she'll make it, but it's not for lack of trying.
I remember my little brother Justin had a girlfriend who was a nurse, and she had a Siamese cat that was 28.
That one I haven't seen that one.
No,
yeah,
and the cat passed away since then. But I remember how traumatized she was. She couldn't remember life without that cat.
Well, yeah, that's true. I mean, this is
I know.
this kitty's been around a long time too. Another important part of early kidney failure is dietary control. Now, what this little kitty's getting, and in fact, right now, I have 3 cats, and right now they're all getting kidney diet, mainly because when you have a multiple cat household, it's hard to control who gets what. I'm basically fairly lazy, so I don't like to cook for my cats, so I just fed this KD. This is a prescription diet. The difference is it's got a low protein level and an ultra high quality. When your mouth eats a bite of food, you swallow it and your body breaks it down. It takes these large protein molecules and tuna fish or steak or whatever you're eating, and breaks down those larger molecules into small usable molecules like glucose for energy. And in the process of this breaking down, this this splitting up of these large molecules, there's waste, nitrogenous waste. Oh yeah,